Hello students. Our concept for week 7, day 1 is nutrition, and our exemplar is normal versus abnormal nutrition. I did ask you last week to bring in some type of food label so that we can kind of look at the labels and see what kind of information that particular food item gives us. And it's extremely important to understand that, because that's the kind of thing that we as nurses and even dietitians need to explain to our patients, because some of them may be on some food restrictions due to a illness, a chronic illness, or maybe they're depleted in certain types of nutrients that their healthcare provider wants them to get more of to reach optimum health, or maybe due to the nature of their illness or their chronic disease, they shouldn't have certain types of elements or products that are in their foods that they eat. So it's very interesting to read these labels, because you need to be sure that you're understanding exactly what they mean. Up on the screen you can see that I brought up Appendix 45, and it just has some foods containing potassium, calcium, sodium, and those are probably 3 of the most important electrolytes that some of our patients are either depleted in or have too much of, and it's important for them to know what foods contain those very, very important electrolytes. You can see that potassium-rich foods are fruits, and of course we know about bananas, and there's various other types of fruits that are very high in potassium. And that might be for a patient that is on a medication that makes them urinate, like a diuretic, where they deplete their potassium levels and they need to replenish that potassium. So those might be some great choices for them to eat to get back that potassium in their body. Vegetables, you can see the vegetables here. A lot of your yellow squashes, beans and legumes, beets, green leafy vegetables. And then there's some other foods also that have potassium. And then you look at your calcium-rich foods, and that might be someone who maybe has a deficiency in calcium due to maybe an endocrine problem, or maybe they have osteoporosis, women who have gone through menopause, and these are some sources of calcium for that individual that they might want to eat on a routine basis. And then, of course, sodium-rich foods. Some of our patients who may be on some sodium restrictions might stay away from these types of foods. Some of your vegetables that have more sodium than others. Milk has sodium, and of course the meats, especially ones that contain salt-cured substances and ingredients, your bacons, your sausages, and a lot of processed foods. Canned foods definitely have a lot of sodium, and any type of food that's prepared in brine, and your pickled foods and some of your condiments have a lot of sodium in it. You can't see it, but I chose a food from my pantry, and it's the macaroni and cheese by Kraft, and it's servings per container. It says that it can serve 3 people, and that's what you have to understand. So with every serving, that a third of this product will bring about 250 calories, and it talks about the calories from fat, the total fat, saturated fat versus trans fat. And trans fats are those bad fats that cause someone to later on acquire heart disease, cardiovascular disease. And this particular food item does not have any trans fat. It does have some cholesterol, but only 10 milligrams. Has a lot of sodium, 570 milligrams per 1 serving. And high in carbs, obviously, because of the noodles, 47 grams. Does have a little bit of fiber, 2 grams, and sugars are 6 grams. and protein is 9 grams. And then it gives you a breakdown of all the different types of vitamins, calcium, iron, and again talks a little bit about all the ingredients that's in it. And it's important to look for some of those bad fats that some of these foods do have in it, and trans fatty acids, hydrogenous fats, all those you see once in a while in some of these foods. And that's what I have really been doing, is looking at labels and making sure that I'm not, especially at my age, eating those types of foods that may have those bad fats, which could later on lead to heart disease. I sometimes look at some of the ingredients and think, I get a little concerned when I can't pronounce some of the ingredients. It doesn't look like there's a lot of bad stuff in this, but there may be some artificial flavoring, which may not be so good. But I think it's important to understand some people could possibly eat this whole box or even half a box, where they might not realize that they are eating 2 servings. So if they are eating 2 servings out of the 3 servings that are in this package, then they're getting a double of all those things that I just mentioned. So if it's 250 calories for 1 serving and they eat 2/3 of this box, they've already eaten 500 calories of their daily allowance, and so forth and so on. So I think that's important to know, that a lot of people are under the impression that even like a can of soup, I think it counts for like 2 servings. And, there's really not a whole lot of soup in that can. And some people on a given day may be able to eat the whole can of soup, which basically they're eating 2 servings, which would double all those ingredients that the label presents to the consumer. So I think that's important to know. And I also have a low-fat yogurt mousse by Yoplait, light and fluffy, and this has 1 serving or 1 container. So in this, I'm trying to see how many ounces. I think it has, I'm trying to see, it has 4 ounces of yogurt in this, and 140 calories, and calories from fat is only 20. And total fat is 2.5 grams. Saturated fat is 1.5 gram, and trans fat there's none, which is good. Otherwise, I would not have brought the product. I do read my labels before I purchase certain foods at the grocery store. A little bit of cholesterol, only 10 milligrams. Sodium is only 75, very low content of sodium. Potassium has 180 milligrams, and total carbs are 25, and there is quite a lot of sugar in this, 21 grams. Protein is only 5 grams, and then again it tells you vitamin A, vitamin D, calcium, and phosphorus content. As far as the ingredients, it says on this packaging, no artificial flavors, no high fructose corn syrup, which is the bad stuff, no colors from artificial sources, and it does have active cultures, which may be good to keep those bacteria in the stomach and the gut, to keep oneself healthy. So that's another example of a food label that it's really important to read and to know what exactly you are consuming when you eat these foods, because some of them are really not healthy. I've changed a lot of my brands due to the fact that they have a lot of that fructose corn syrup in. I found that to be in some of the salad dressings and some of the condiments like ketchup and mustard. So I've changed my brands to be sure that I'm not taking in those really unhealthy fats, especially at my age. So I hope this just gives you an awareness that it really is important for us to read our labels when we're purchasing food, and this is the kind of information that we need to pass on to our patients, especially even if they are healthy. Let's talk about health promotion. Let's be sure that they're eating the right things so they do avoid, getting heart disease and hypertension and things like that. So I think they need to be in charge of what they consume, and they can do that by being aware of exactly what contents are in the foods that they're eating and purchasing at the store. So I very sorry that we could not do that this week, but I did want to just give you some examples of some of the nutrients that are presented on the labels of the foods that we do consume. And if you, by chance on your own, choose a package of food at your own home or in your pantry or cupboard, you might want to look at Appendix 46, because this is what we would have probably went over. You know, to determine if what you're choosing to eat is a nutritional food choice. You yourself know what your genetics are, and some of you are very young, so maybe this really doesn't apply to you because you feel like, oh well, I maybe don't eat as healthy as I should, and I'm young, and I'll definitely change my ways maybe after you get out of nursing school. But it's kind of good to start in great habits right now, even at any age, because a lot of the things that you do and a lot of things that you eat really will benefit you as to what kind of health you'll have later on in your 40s and 50s. Looking at food choices with the recommended dietary intake of sodium, sugar, protein, saturated fats, calories, and carbohydrates, and to discuss the type of patients that should avoid or consume these food choices. And we've talked about this a lot, especially some of our patients too that are, so many of them have cardiovascular diseases, hypertension, they've already had coronary events, their circulation isn't good, so these people would truly benefit just really understanding about the food choices, and not only include your knowledge to them, but offer to have them spend some time with a dietitian. Diabetes is obviously a very serious and chronic disease, and when our patients do have this particular disease, diet is everything to control that blood sugar. So maybe there are certain things that they should not be eating, because as we all know, just having diabetes puts them at such a high risk for some of these very, very serious and unhealthy chronic diseases. And question 5, what are some of the challenges associated with overcoming unhealthy food preferences, especially among clients who have eaten the same way for more than 40 years? What do you say to the patient who says, I don't like fruits and vegetables, or I would miss eating McDonald's if I had to give it up? And these are some of the things that your patients may express to you, and I'm sure as nurses we don't always make the right choices when it comes to food. None of us are perfect in that way at all, but there has to be some type of moderation or balance within eating foods that maybe aren't as healthy. We have to kind of self-reflect and look at ourselves and say, hey, is the purpose of the way I eat to stay healthy, or do I need to lose weight, or do I need to keep my blood pressure down, or do I need to really be careful of high fatty foods because my genetics really have given me an opportunity here to acquire heart disease and cardiovascular disease later on in life. So these are things that you'll have to ask, and maybe knowing your patient's history might hone into exactly what kind of food choices your patient should be partaking of and consuming of. And it's always good to include the person in the family who does the cooking or even who does the grocery shopping. But I think all patients should be responsible for the foods they eat, and to know exactly what is in those foods. It's always recommended to eat a lot of fish products, and stay away from some of the beefs, especially if you have a tendency towards acquiring cardiovascular diseases. But fish is one of those kinds of foods that not everybody really likes. So are there substitutes? Not a whole lot out there. If you don't like fish, you probably don't like a lot of the other choices of fish. So just things to think about. But if you have to eat beef, maybe eat more of a leaner beef, more of a beef that has a tendency not to have so much fat in it to have that cause you to definitely acquire some type of coronary disease. So that's just a little rundown of food labels and the importance of them, and really to be aware of exactly what we're eating in our foods. And what's also nice is nowadays our restaurants are very accommodating to people that do have food restrictions, and many of them, when you place your order at a restaurant, they'll ask you if you have any allergies or any restrictions. And many of these restaurants out there will very much make your food accordingly to how you want it prepared. If you don't want it cooked in butter or whatever, you may say, I just want it grilled, or I don't want that added to it, or things like that. Or if there's some preference of food that you really dislike, you can definitely have that food taken out. So be sure and speak up and remind your patients that they have the option of doing that. And restaurants out there are really happy to get your business, and they'll definitely prepare the food exactly the way you want it prepared. And you'll enjoy going out more because you won't feel as guilty knowing that you're kind of not adhering to the kind of diet that your physician or yourself know that you need to because of some of your health issues. So that's another thing I just wanted to kind of talk about. And here on Appendix 47 are 4 types of foods from different cultures. And the first one is the Mexican culture, and this is kind of a description of what kinds of food pretty much represent the kinds of food that this culture eat. And you can see they like corn, hot peppers, and beans. It's in a lot of their dishes, and the culture uses over 100 different types of chilies, which range from large and sweet to small and extremely hot. And a Mexican diet starting with breakfast may begin with coffee and fruit. By morning, a warm tortilla-based snack is added, and the most important meal of the day is served between 2 p.m. and 4 p.m., consisting of 3 or 4 courses. And these are all the courses that they may have. They eat a lot of soup, rice, and pasta, and this may be accompanied by tortillas and refried beans and dessert. Dinner is served between 8 and 10, and this is what it involves. Mexicans like to eat outdoors frequently, drink beer and soft drinks, and the national liquor is tequila. And food customs are often seen at ceremonial Mexican occasions. And for any of you that have eaten in a Mexican home or have even gone to Mexico, can definitely validate these types of foods that this culture represents. Then we go to the Japanese, and this culture has an obsession with food. It is much about the prep as well as the presentation, and chefs bring out the color and flavor of the food, so to do as little as possible with it. And the Japanese cuisine is one of only 3 national food traditions recognized by the UN for its cultural significance. Tempura is a highly popular way of preparing vegetables or seafood, which is really not the most healthiest way, but the foods are covered in a light batter and deep fried. And then you might have takoyaki, grilled or fried octopus, and sushi are popular dishes in Japan. And sushi is a dish of rice cooked with vinegar on top with seafood. And if it's uncooked, it's made into rolls. Rice is served at every meal, and I'm sure you can kind of see where this is at, because you've probably gone to some of those hibachis and went to some of those Japanese restaurants, and definitely rice is always served. There is an infrequent use of garlic, chili peppers, and oil. Foods are seared, boiled, or even eaten raw, minimally seasoned. And miso, soy sauce, and mushrooms, seaweed, and bonita flakes are added to some foods to enhance flavor. And condiments such as light dipping sauces, citrus, mismo, wasabi, pickles, and soy sauce may be used in preparing the Japanese cuisine. And you've got to be careful of those types of seasonings, because many of them have high content of sodium. There is a soy sauce out there now that does have low sodium for people that really have to watch their sodium intake. The seafood industry is huge along with vegetables, and in the Japanese culture it is rude to leave a messy plate after eating, so tea with meals is seen as an art. So that's your Japanese cuisine. And then next we have the Mediterranean, and this is a very popular diet. people really try to adhere towards the Mediterranean diet for those that just want to lose weight or stay healthy, because it's centered on olives, wheat, and grapes. It's a plant-based diet consisting of whole grains, fruits, vegetables, herbs, spices, beans, nuts, and olive oil. And eating within this culture is a time and a place for interaction, raised to the level of religion. Rarely is red meat eaten. There is a moderate intake of poultry, eggs, cheese, and yogurt, and the culture partakes in drinking moderate amounts of wine with their meals. So it's a very healthy way to eat, and it's very plant-based. And then lastly, we have the African American. The cuisine of this culture consists of fried chicken, macaroni and cheese, collard greens, breaded or fried okra and cornbread, and such side dishes are hush puppies, ham hocks, and black-eyed peas. Another favorite is chicken, fried steak, giblets, such as chicken livers and gizzards, and ham and bacon are used plentiful in flavoring and in gravies and sauce, and grits are an African American favorite with this finishing touch of a cobbler, pecan pie, or sweet potato pie. And as you look at these 4 different types of cuisines from very prominent cultures, you could ask yourself, which one of these cultures are more at risk for heart disease, and which of them are more at risk for, leading a more healthier type of living in regards to their diet. And so you need to look at each of these and say, hey, what is it about each of these certain ingredients or food choices within this culture? Is it healthy or is it unhealthy? Is there any modifications that can be made? And does it provide all those daily requirements for a healthy adult, and even for children to grow healthy as well? And do some of these diets contribute to chronic diseases such as coronary artery disease, hypertension, and diabetes? And what diet should be modified if the person had a history or was diagnosed with some of these serious diseases? Also, you want to think about people that are trying to lose weight. And I kind of gave you a clue that the Mediterranean might be a very good way to try to lose weight. And even the Japanese, there are some health benefits to some of the sushi that the Japanese culture presents. But you have to like that type of food. And people aren't going to eat foods that they don't like. I'm not particularly fond of sushi, but I do like rice. But you can't live on rice. You need some protein and things like that, as you well know. So I just wanted to go over this exercise with you and just keep you aware of some of the more prominent cultures and kind of what foods represent that culture, and is it a good thing or a bad thing? It may taste good, but it may not be the healthiest way to eat. So that's why we may see some people from these particular cultures have a higher incidence of some of these more serious chronic diseases. So I just wanted to kind of go over that with you, and hopefully you read this and you kind of think about these foods. You may see a question on the test regarding these types of cultural foods, or selection of foods in this particular culture. So you might want to kind of read this over and kind of think about these questions and kind of answer them to yourself. And if you look at Appendix 48, here's just an evolving case study about a young 9-year-old Hispanic female. She's seen in the pediatric clinic today for a well-child checkup because she wants to play softball in the fall. Stacy weighs 120 pounds, which places her at the 120th percentile for weight. She is 55 inches tall. Stacy's blood pressure is 130/90, and her heart rate is 90 beats per minute. Stacy's mother is visibly overweight, and Stacy's mother knows that obesity is a problem in many school-age children today and asks for help in changing Stacy's diet, lifestyle, and weight loss strategies. The nurse asked Stacy to do a quick 24-hour food recall, and Stacy identifies the following. This is what she has for breakfast: 2 Pop-Tarts, glass of chocolate milk, and 1 glazed donut. For lunch, she has 2 slices of pepperoni pizza and 2 breadsticks, 1 serving of canned peaches, a bottle of fruit juice, and a sugar cookie for dessert. And for supper, she has 3 chicken and enchiladas, Mexican rice, refried beans, chips and salsa, and 2 sopapillas. When the nurse asks about exercise, Stacy says she really does not do any exercising except for her recess at school. So as you look at these questions, you can tell right away that this diet is very concerning because it really represents a lot of fat, a lot of sugar, and some nutrition, but not a way for a child who's already facing obesity should be eating and partaking in. So if you look at question 1, in evaluating Stacy's diet, what findings would concern the nurse most? And probably what that answer would be are the high carbohydrate foods, the lack of protein intake, excessive calories, and a lot of vitamin deficiency foods, which is pretty obvious. Why might Stacy's blood pressure be high? And I think you all know what that is, because first of all, she's overweight. If you look at her probably BMI, she's only 55 inches, which she's not even 5 foot tall, but she already weighs 120 pounds, and she's at the 120th percentile for weight. So her weight definitely could be the reason why her blood pressure is high. She doesn't exercise much. She has a lot of sodium intake due to the choices of food that she's making, and because of her ethnicity. She's a Hispanic, and those people really have a tendency, that culture, to have high blood pressure. What role, if any, does Stacy's ethnicity play in her weight problems? Hispanic Americans are at a greater risk for obesity, and as we just recalled and looked at, the Mexican diet, traditional diets, are very high in calories. And then what could be the cause of the elevation of Stacy's blood pressure? Definitely it's her size and her obesity that does place her at risk for her high blood pressure, as well as her elevated sodium intake. I think this is a great question. Question 5, should Stacy's mom be concerned, and what should the nurse teach her at this point? Of course her mom is probably very concerned, because she knows that she herself is obese and she doesn't want her child to follow in the same footsteps. She is significantly overweight, and her diet is high in calories and very poor in the necessary nutrients for a child who's 9 years old. She's definitely at risk for developing type 2 diabetes, and her blood pressure is too high, which puts a lot of stress and strain on her cardiovascular system. And the nurse should teach Stacy and her family the importance of activity and refer them to a dietitian for meal choices and preparations. We got to get to the bottom of this, but do it in a very non-judgmental way, because this is a very sensitive area when we're talking about somebody's weight. And of course, this mother probably feels extremely guilty because her child has gotten to this point where she's now obese and has some very, very serious health concerns. So she probably takes the responsibility of why this has happened, and in some ways it is her fault, because she's probably the one buying the food, and if it's not in the house, the child can't eat it. But sometimes, due to ethnicity and culture, the mother just probably felt that this is the way she was raised, and provided the same types of foods to her child, and then this is where we are at this point. So if we look at Part B, Stacy returns to the clinic 6 months later with complaints of feeling tired and having a sore throat, and Stacy's weight remains at the 120th percentile, and her mother relates that Stacy is also being followed for her elevated blood sugar. Her blood pressure is 136/92, and Stacy and her mom report that Stacy has not really changed her diet and that she is exercising some, but she really enjoys her video games and staying inside. She was not successful at her athletic events because she could not run fast enough. A diet history is similar to that reported in her first visit. So things really are not that different, and I'm just very concerned that diastolic blood pressure continues to go up as well as the systolic. And she's not seeing the importance of getting out and exercising. She's staying inside the house and being a couch potato and playing with her video games, which won't give her too much exercise. And I'm also concerned about the fact that her blood sugar is starting to rise, so she may be on that borderline of pre-diabetic, which is very serious at someone who's 9 years old. And these things can be changed if certain lifestyle is changed, and we've got to get down to the bottom of this right now. So what are the priorities for care for Stacy at this time? And really, I think now we have to look at what is the best approach to changing her dietary intake, and she must begin to do some type of exercise. So we have to think about what are the appropriate interventions for this child. She's only 9 years old, and we have to start her off slow. Okay, she's not in the best shape, so she can't go out and run 5 miles. Maybe we could include some friends and get them to kind of start exercising with her, and maybe holding her accountable for, maybe just taking a short walk around the block. And what risk, if any, does Stacy's blood pressure have on her overall health? And it does predispose her to heart disease, to eye disease, and to kidney disease. And think about what types of lab tests would you expect the practitioner to order. And obviously, a serum cholesterol and lipid profile, a chem profile, and let's see what her heart's doing. So maybe we'd want to do an ECG on her. What resources are available to Stacy's mom with meal planning and food selection. And we could provide a dietitian to come and speak with her and give the mom and the child some handouts, or if there is not one available at this particular place, that we could contact one at the local hospital. So there is all kinds of people out there from other disciplines to help this family and get this child on a healthy track. We can now advance to Part C. So now Stacy comes to see the nurse in the clinic at her school. She tells the nurse about her feelings, about her weight, and her need to exercise. And she's lost 7 pounds but cannot seem to lose any more. She asks the nurse to help her develop a plan for 3 days, considering she eats breakfast and lunch at school. So now we're seeing some positive results. So she must be starting to exercise, and she's lost some weight, but she's kind of being stagnant with that. So how would you follow up with Stacy? And what we could do is just kind of look at what she's eating. Some people do not realize that maybe they're not eating as healthy as they think they are, and it would be nice to see a list of the foods that she's taken in the last 3 days. And they might want to provide Stacy and her mom the myplate.gov site with Stacy, and to begin to teach her about the role of nutrition and all these different nutrients that should be in her food. She's 9 years old. She's probably in the 3rd grade. She can handle some of this. We could, say it very plainly so that she understands, and then maybe give a little bit more detail to the mom, but at least she would have an idea about the nutrients needed and about how many calories she needs to be able to lose weight. Okay. How would we encourage exercise? Maybe the mom or the nurse could encourage exercise through positive or reward reinforcement, and I would think that she would just begin at a walking exercise or maybe another aerobic exercise. Maybe we might get her on some type of athletic activity at school, and maybe keep a chart of when she exercises every day and for how long, and then she could report that information back to the nurse when she goes to see her for a follow-up. What teaching would you perform at this time, or what role should the school play in providing options for food choices? Making sure that the schools are providing a healthy lunch program, and sometimes the schools also provide after-school programs. And we would want to definitely monitor food intake and activity, and kind of a way in which she can learn how to calculate her calories in all the food choices that she does. And we can also teach her about her heart rate and how she has and how her heart does respond to the various exercises that she begins to gradually take part in. And I think it's important too that we teach Stacy about the relationship between obesity and blood pressure, and talk to her about how heart disease can happen, and how exercise will help decrease that blood pressure if she continues to do that. And this last question is about, would you include Stacy's peers, and if so, how would you involve them? I think we'd only want to include them if Stacy wanted them. But for now, this is about Stacy. Unless she wanted her peers or friends to be involved, then that would be a different story. So only with her permission would we get her friends or her peers involved. So this is kind of a recap of how nutrition and diet can affect even a child at 9 years old, and what kind of changes we could teach this family about to get this young girl on a healthier track. And it might be also a time where mom herself may want to get healthier and begin to lose weight, since she also has a problem with her weight. We don't know if there's other children in the family, and we do still want to continue to respect the culture and the foods that this culture honors, but there may be ways in which we can modify some of those foods and make them much more healthier. So there are things that we can do that really that don't change their traditions that this particular Hispanic culture have. So we always want to be respectful of that. We don't want to degrade the foods that are in a particular culture, but we do want to bring it to the intention that some of them may have nutrients that can cause some of these problems, as this young girl has definitely experienced. As you can see up on the screen, I just brought up this article from Medscape on childhood or pediatric obesity guidelines. I'll post this website, so if you have an interest in reading this article, please feel free to do so. The paragraph here starts off with that obesity is an epidemic among adults as well as children and adolescents in the United States, and the current recommendations from the Endocrine Society focus on the prevention, diagnosis, and management of pediatric obesity. And a study by Ogden and colleagues, which appeared in the June 7th, 2016 issue of JAMA, evaluated the epidemiology of pediatric obesity by using data from the National Health and Nutrition Examination Survey. Now this data is quite staggering. That more than 40,000 U.S. children and adolescents provided data for the study, and the most recent study period was between 2013 and 2014. And between 2011 and 2014, the prevalence of obesity among individuals between 2 and 19 years old was 17%. And extreme obesity, defined as a body mass index or more than 120th% of the 95th percentile based on sex age, was identified in 5.8 of the study sample. And it just goes on to talk about some of the guidelines. So I just thought this was important to bring up, since we are talking about abnormal nutrition. It states again that pediatric obesity remains an ongoing serious international health concern, affecting about 17% of the U.S. children and adolescents. And remember, this may even be higher by now because the study was done in 2013-2014. So these statistics may even be more alarming than they are right now. But the good news is they do say that some of this childhood obesity has appeared to stabilize, but I'm not so sure about that. It says the not so good news is that task force members were obliged to add new definitions for extreme obesity, a group that unfortunately continues to increase in prevalence. That's what I thought. And children older than 2 years 2 years are considered extremely obese if they have a BMI of at least 120% of the 95th percentile, or at least 35 kilograms per meter squares, depending on their ethnicity. So they look at children that are obese as well as their other comorbidities. Okay, so I just wanted to kind of share this article with you, and just to make you aware that this is a very serious problem, especially for those of you that want to go into pediatric nursing. And I think it's important that, you know, this can be curtailed, and we can get our children to be healthier. And I think some of our school programs, our nutritional programs, are getting better. But, you know, what's the cause? Is it diet? Is it lack of exercise? I don't know. There's a lot of variables that could account for why our children are so much heavier than they were years ago, even in my days of childhood. But it does talk about how bariatric surgery should be the last resort. So that's something, you know, if people think, oh, well, I'll just have that surgery, may not be the best choice for some people. So these are the guideline highlights. First two, these were developed by 6 experts selected by the Endocrine Society, and how they diagnose it, and routine lab workup, and then overweight and obese children should receive routine screening for lipid disorders and prediabetes or diabetics, and then serum insulin levels should not be measured routinely, and genetic testing should be offered for children who have extreme obesity before age 5 and have clinical features of genetic syndrome, particularly hyperphagia or a family history of extreme obesity. And children and adolescents currently consume on average 30% to 40% of their total calories from nutrient-poor, calorie-dense foods and drinks. And the current recommendations strongly recommend consumption of whole fruits versus fruit juices and the substitution of sugar-sweetened beverages with water. Our kids are not drinking enough water. How much exercise a child should have a day, and how much screen time, whether it's on a computer, on a iPad, or whatever, that should be limited. And they are showing a lot more research with kids who just have their face in their iPad all day long or playing video games. Efforts to limit obesity should involve the whole family and not just the child, and physicians should evaluate levels of family stress and communication. And this is the first step in the treatment of pediatric obesity. And they talk about medications may be considered for children and adolescents in whom lifestyle interventions fail, but they should be withheld among children younger than 16 years with overweight alone. So these are some of the meds that they may give. And medication should be discontinued at 12 weeks if there is no evidence of significant weight loss. And like I said before, bariatric surgery may be considered for adolescents with obesity in whom lifestyle changes and pharmacotherapy fail. So I think this is very, very important information, but it's also very alarming as well. So here's the rest of that article. Okay, I just want to go through this PowerPoint on nutrition and our exemplar of normal versus abnormal nutrition. We just got done talking about pediatric obesity, and this is how they define obesity. And I won't read it, but go ahead and go over this, where it's defined as weight that is higher than what is considered as a healthy weight for a given height is described as overweight or obese. And it has to do with your body mass index, or your BMI, as a screening tool for overweight or obesity. And you can go on the CDC, which defines this even more explicitly. Okay. And if your BMI is less than 18.5, it falls within the underweight range. If your BMI is 18.5 to 25, it falls within the normal range. And if your BMI is 25 to 30, it falls within the overweight range. And if your BMI is 30 or higher, it falls within the obese range. So these are some of the guidelines, okay? And BMI does not measure body fat directly, but research has shown that BMI is moderately correlated with more direct measures of body fat obtained from skin fold thickness measurements, bioelectrical impedance, underwater weighing, and dual energy X-ray absorptionometry, your DXAs, and other methods. BMI appears to be strongly correlated with various adverse health outcomes consistent with these more direct measures of body fatness. Now, since we're talking about abnormal nutrition, think about some of the eating disorders, okay? One of them is anorexia nervosa, often simply called anorexia. It is an eating disorder characterized by an abnormally low body weight, intense fear of gaining weight, and a distorted perception of body weight. People with anorexia place a high value on controlling their weight and shape and use extreme efforts that tend to significantly interfere with activities in their daily lives. Now, this is a very, very serious eating disorder. Some of these people need frequent counseling. No matter how thin or heavy they are, they never feel good about themselves, and they really have a very distorted perception of their body weight, and they'll do anything to make sure that they achieve that weight that they think they should be in. Okay. And to prevent weight gain or to continue losing weight, people with anorexia usually severely restrict the amount of food they eat. They may control calorie intake by vomiting after eating or by misusing laxatives, diet aids, diuretics, or enemas. And they may also try to lose weight by exercising excessively. And no matter how weight loss is achieved, the person with anorexia has an intense fear of gaining weight. And this is a very serious situation, because it can lead to a lot of metabolic problems, electrolyte imbalances, nutritional deficiencies, and these can then lead to some very serious and life-threatening cardiac arrhythmias or cardiac issues. So this is something that we need to diagnose and get a hold on as quickly as possible if we suspect somebody we know is suffering from anorexia nervosa. Now, we also have the eating disorder of bulimia, and people with bulimia may secretly binge, eating large amounts of food, and then purge, trying to get rid of the extra calories in an unhealthy way. For example, someone with bulimia may force vomiting or engage in excessive exercise. Sometimes people purge after eating only a small snack or a normal-sized meal. So they want the gratification of tasting that food, but then they feel a lot of guilt, and then what they'll do is they vomit or go and try to run 5 miles to burn up those calories. Bulimia is more of a person that may have normal weight or, be above in their weight. And then purging bulimia is regularly self-induced vomiting or misuse of laxatives, diuretics, or enemas after binging. And non-purging use other methods to rid self of calories and prevent weight gain, such as fasting, strict dieting, or excessive exercise. Somebody may go on some of these crazy fads that, they drink so much water, and then all they drink is grapefruit juice and all that. Well, these aren't good, because most people who do lose weight end up putting it back on when they start to eat normal foods. But this is a different story. This is somebody with some very serious eating disorder that really can lead to some very serious outcomes with their health because of poor nutrition and the fact that they're misusing laxatives and diuretics and things like that. And lastly, I wanted to talk about celiac disease. And celiac disease is someone who is unable to digest gliadin, and we know that it has to do with gluten, and that's a protein that's in wheat, rye, oats, and barley, and those actually break down into gliadin, into the small intestines, and when people have celiac disease, they're unable to digest that. So you have an accumulation of glutamine, and there appears to be a toxic effect on the mucosal cells, and there's an atrophy of the villi, malabsorption of fat, calories, carbohydrates, and vitamin deficiencies, and these people may go into what we call a celiac crisis, where they can have severe dehydration and diarrhea. And again, with celiac disease, some of the risk factors and the cause of celiac disease is unknown. However, genetic and immune factors are known to play a role in the development of this problem. Having a first-degree relative with celiac disease significantly increases your risk, and high-risk populations have been identified in familial forms of celiac disease, including individuals with iron deficiency anemia and those with osteopenic bone disease. And again, the clinical manifestations of celiac disease are the inherited inability to digest gluten, malabsorption syndrome, familiar disease, most common in Caucasians, cause unknown, thought to be a problem of metabolism, diagnosed in young children, 12 to 18 months, but it can occur at any age, and treatment is to avoid gluten in the diet. Okay, and these patients also experience abdominal bloating and cramps, diarrhea, and steatorrhea, and anemia is common, and most of these patients with celiac disease are often small in stature and may have delayed maturity. Other signs of nutrient deficiencies include tetania, vitamin deficiencies, muscle wasting, and rickets. And when gluten is removed from the diet, the manifestations typically resolve. And gastrointestinal malignancies and intestinal lymphomas are potent potential complications of celiac disease. And sometimes it can even go to the extreme cases of intestinal ulceration and development of refractory diseases, or diseases that no longer respond to a gluten-free diet. And what they do to diagnose celiac disease, they do a direct examination of intestinal mucosa and a collection of a tissue specimen for biopsy. And tissue biopsy is really necessary to establish the diagnosis of celiac disease. And they'll do a upper GI series with a small bowel follow through to evaluate those structures of the upper GI tract. And with celiac disease, the typical feathery patterns of barium are in the small bowel is lost, and the barium may precipitate and clump. And what happens is laboratory tests are used to identify pathophysiological effects of the disease, and because the fat content of stool is increased in many malabsorption syndromes, including celiac disease, fecal fat is measured to document the presence of steatorrhea. So that's kind of what they do with celiac disease. I just wanted to give you a little bit more information on that.